Welcome. Wednesday, March 8th, 2023. It is 3:05 p.m. and our regular scheduled hearing is at 3 p.m. So if you could help me just kind of like clear the air of all that education conversation that was going on, I would appreciate that. And I know there was a little myth out there, and I know Senator Utke had a question for me, but we do have a quorum because I know Senator Utke is here as well, right? And part of it was, I'll play the joke later, but you guys just stick with me when I ask why we were late. When Senator Utke asked why we were running late, just you guys will help me out on this because there's a certain senator from Anoka we're gonna blame it on. Is that fair to everybody? Full agenda. We have Senate File 2489, which is mine. Then we have Senate File 2397, 2282, and 1769. Senator Rasmusson, and then Senator Abeler, and then Senator Fate. And I think with where we're at, Senator Rasmusson, if you are, do you want to? Can I move the agenda? Are you guys okay? Is everybody okay with that? To maybe we'll get to, since Mary Hoff is here with Jean. I see Jean there. Jean and Mary, come on up to the table with Senator Rasmusson. This is one of those bills that I think we're going to like. So. Senator Rasmusson, welcome to your committee.
Thank you, Mr. Chair. And I have some amendments just to make sure I get the bill in the shape we want it to. So I would move the A1 amendment.
A1 amendment. Members, do we have the A1 amendment in our packet? Yes, we do.
And Mr. Chair, I also have an amendment to the amendment that I'll ask council to report.
Mr. Monahan.
Mr. Chair, members, Senator Rasmusson's motion would be on page 1 of the A1 amendment, delete line 12.
Any questions for Mr. Monahan or Mr. Rasmussen, Senator Rasmusson, regarding the amendment to the amendment? Seeing none, Mr. Senator Rasmusson moves the amendment to the amendment. Make sure I get this right. All those in favor say aye.
Aye.
Aye. Opposed, same sign. And then that brings the A1 amendment. Any questions for Senator Rasmusson? Senator Rasmusson renews his motion on the A1 amendment as amended. All those in favor say aye. Aye. Opposed, same sign. Now that your bill is in the order that you deemed it, and I did not mess up the amendment to the amendment thing. I appreciate that. But Senator Rasmusson, it is your bill. Thank you.
Thank you, Mr. Chair, and thank you for the opportunity to present Senate File 2397 today. This is a proposal to increase access to supported decision-making, a less restrictive alternative to guardianship and conservatorship. I also want to thank Senator May Quaid for her support and for co-authoring this proposal. In your packets, you'll find a one-pager for this proposal along with a letter signed by organizations that are supporting this bill. The heart of this bill is about supporting independence and informed choice for persons with disabilities and older adults. For a long time, the primary tool we used in society when someone had diminished capacity to make decisions was a court-ordered guardianship. Thanks in large part to the years-long effort of disability advocates to bring attention to the drawbacks and limitations of guardianship, significant reforms and updates were made to Minnesota statute governing guardianships during the 2020 session. Those include requiring less restrictive alternatives to guardianship to have been tried before a guardianship is ordered, official recognition of supported decision-making as an alternative to guardianship, and other reforms. Supported decision-making assists an individual to understand the nature and consequences of potential personal and financial decisions. It enables the individual to make decisions with support of others and is a less restrictive alternative to guardianship. Unfortunately, guardianship is still used too often in Minnesota. Additionally, Minnesota does not invest in supported decision-making, which creates barriers to accessing and providing this service. This bill would establish a new grant program administered by the Department of Human Services for organizations and counties to develop and enhance their supported decision-making services. It also directs DHS to issue a report with recommendations for medical assistance programs to provide reimbursement for supported decision-making services. This proposal is critical to facilitating a cultural shift toward supported decision-making services as a first, more person-centered choice. And with that, Mr. Chair, I would like to pass it over to my testifiers today.
Thank you, Senator Rasmusson. And Ms. Hoff, who's going first? All right, Jean Huff, welcome to the committee. And tell us, state your name, please, for the record. And we should record this because Sunday night, Partners in Policymaking is doing mock hearings, right? This is absolutely, you're actually doing a hearing and you're testifying on a hearing. So we'll have to let the good Dr. Colleen Wick know. This is awesome that you're here. So Ms. Hoff, welcome to the committee.
Mr. Chair and members, my name is Jean Huff.
Can you get the mic closer?
Mr. Chair and members, my name is Jean Huff. Thank you for the chance to testify. Support decision making is good. That is why I support Senate File 2397. I want to live my own life and make my own decisions. I am deciding about going to college, my career, where I live, and who I vote for. Sometimes I need help like anyone else. My family, friends, and coworkers support me. I like to understand my options. Making my own decision is empowering. Before I turned 18, my mom explained supported decision making to me and gave me the choice. My mom helped me find an attorney who understood the supported decision making. My attorney helped me prepare the legal documents I needed as an adult. In 2020, I will advocate for updating the Minnesota scholarship law to include supported decision making. It was appointed to update the law, but that is not enough. There are more Minnesotans with disabilities and their families who do not know about supported decision making. They need to know the different choices. They need to know who can help. They have the right to make their own decisions and live the life of their own. Senate File 2397 will increase access to supported decision-making, information, and services. I think everyone deserves the chance to decide and use supported decision-making. Please support Senate File 2397. Thank you.
Ms. Hoff, thank you for your testimony, and thank you for letting us know how important supported decision-making is in your life. That's important to us. And I see you have a special guest next to you, somebody I think I've known for a few years. Can you introduce your guest for us?
The person I'm introducing to is my mother, Mary Ann Hoff.
Ms. Hoff, welcome to the committee.
Thank you. Chair Hoffman and committee members, my name is Mary Hoff, and I'm here today in support of Senate File 2397. Thank you for the opportunity to testify. I'm a parent of 4 young adults. We are coaching each of our children as they increase their independence and live the life of their choice. As each of our children approached adulthood, we helped them plan for turning 18 and putting the necessary legal documents in place. Jean was no different other than members of Jean's education team, her doctors, and social service providers were all directing Jean towards guardianship. It did not feel right, or was it consistent with our high expectations for Jean and her capabilities. I was fortunate to have a network of support that included an attorney who knew about supported decision-making. Because I proactively stayed ahead of the next stage of Jean's life, I learned about supported decision-making and considered it as an alternative to guardianship. Once Jean learned about supported decision-making, she did not hesitate to decide that was a direction she wanted to go. Supported decision-making is right-sized support that gives Jean the space to make her own decisions and build her decision-making confidence. Had it not been for our family's personal connections and bandwidth to advocate, Jean would most likely be under guardianship. This is the case for many Minnesotans with a disability and their families who do not have access to supported decision-making information or services. Minnesota's current statute requires families, their advisors, and the courts to consider less restrictive options like supported decision-making as an alternative to guardianship. This is not well known or widely understood. It is critical that the state appropriates funds to organizations that have expertise in supported decision-making that will expand access to supported decision-making information and services. Senate File 2397 will address the limited access with critical funding. That is why I support Senate File 2397 and hope that you will too. Thank you.
Thank you, Ms. Hoff. Senator Rasmusson, you have another testifier, I think Amanda Vikstrom, the Executive Director of the Minnesota Elder Justice Center. Come on down. Welcome. Welcome to the committee. I need another chair up there, I think. Ms. Vikstrom, welcome.
Thank you. Good afternoon, Chair Hoffman and members of the committee. My name is Amanda Vikstrom. I'm the Executive Director at the Minnesota Elder Justice Center. We are a statewide nonprofit that addresses elder abuse and vulnerable adult abuse by providing victim advocacy with individuals and technical assistance for professionals who are working with or on behalf of older or vulnerable adults. So we work with victims and address their safety needs while also helping them preserve as much autonomy as possible. We have found, and research indicates, that when individuals, especially those with diminished capacity, are empowered to make their own informed choices, they're actually less likely to experience abuse. We at the Minnesota Elder Justice Center do not provide supported decision-making services, but we do frequently work with individuals, older adults, and those with living with disabilities to undo abuse they are experiencing in guardianships. So we help people when things are falling apart. We are constantly looking to organizations like Lutheran Social Services and Volunteers of America to provide supported decision-making services to prevent unnecessary guardianships and prevent abuse in an upstream way. We see every day in our call volume that the demand for supported decision-making services continues to grow, but providers like LSS and VOA and others must turn away hundreds of people each year due to lack of funding. The state grants provided through this bill would create opportunity for those providers, tribes, and counties to increase their own capacity and create equitable access across the state. On behalf of the many organizations statewide who serve older adults and persons with disabilities every day, thank you to Senator Rasmusson for carrying this bill, and we would urge your support for this critical resource.
Thank you, Ms. Vikstrom. So, Senator Rasmusson, any questions for the good senator or any of the folks that testified? If not, Senator Rasmusson, comments and disposition of this bill, and have at it.
Thank you, Mr. Chair, and I appreciate the testifiers coming and sharing their stories today and how supported decision-making is helping improve the lives of Minnesotans. And this legislature has already recognized the importance of this with the reforms that were made back in 2020. and now we need to fund it. We need to make sure that whether it's counties, tribes, other organizations that are providing these services, that they're able to get and talk to the families who otherwise would just have guardianship as an automatic default. And this is going to allow people to live with more independence and allow them to thrive. And we see that when individuals with disabilities or are elderly who would be going towards guardianship, if they're able to have supported decision-making, it improves outcomes and it improves their autonomy and their place in our community. And so I think this is going to be an important priority for us going forward.
Thank you. Any questions for the good senator? Senator Rasmusson, thank you for bringing this. Going on. Senator Utke.
Thank you, Mr. Chair. And Senator Rasmusson, looking at under the appropriations, is this an ongoing appropriation after this gets started, being it's got 3 years spelled out so that we don't have to look at it? I mean, it'll keep rolling.
Senator Rasmusson.
Thank you, Mr. Chair, and thank you, Senator Utke. With the amendment that was adopted, it would be for 2 years, $7.5 million each year, and it would be ongoing as well. But that's how we're starting, and then additionally, there will be an annual report to the legislature and actually to this committee on how those dollars are being spent.
Senator
And the additional point that I'll add is there's a requirement in the bill for DHS to pursue how these services could be covered through CMS and to see if that is something that they could leverage in terms of funding going forward.
That's a good tidbit of information. Senator Utke, follow up?
Thank you, Mr. Chair. No, perfect. Thank you. I just had not converted or copied over the amendment onto that line yet, so thank you.
Senator Rasmusson, thank you. Senator Utke, thank you for being that fiscal hawk that you are, man. That's I appreciate that. It would be really amazing if we could get the Centers for Medicaid Services, because this is really an important bill. I know our own office, our committee administrator was involved with some really sad situations that occurred because of that, and I'm grateful that you brought this bill forward, and thankful for you and Senator Mayquade for making this a big priority for us, and I appreciate you guys. Senator Rasmusson, on that note.
Thank you, Mr. Chair. And the other thing I'll add for committee members' consideration is that guardianship is also very expensive to the state and to families, and to the more independence we're able to provide individuals, frankly, the less responsibility and control the state has, county, human service departments have. And so that's the other thing too, is by allowing people to have the tools to live more independently, I think that'll have system savings as well.
Thank you. It looks like we're going to lay this over for possible inclusion. So thank you very much for that. And this is laid over. Let's go to Senate File 2282. Senator Rasmusson, you might as well just stay here and get your 3 bills that you have. Provisions, modifications regarding Minnesota residents admitted to adjacent state mental health facilities. And it looks like you have an amendment there as well, Senator Rasmusson.
Thank you, Mr. Chair. Yes, I would move the A1 amendment, which is just a technical author's amendment to get the bill in the shape I would like.
Comments, questions? A1 amendment is in front of members. All those agree, say yes. Opposed, same sign. A1 is amended. Thank you. Senator Rasmusson, now it is in the form and the process and strategery that you like, so the bill is yours.
Thank you, Mr. Chair. This bill is a technical cleanup bill from DHS, and it will update the physician assistant and advanced practice registered nurse bill that was passed last session, and that bill clarified the role that advanced practice registered nurses across state statutes. The statute was amended to allow an advanced practice registered nurse certified in mental health and licensed in a bordering state to act as a court examiner for a Minnesota resident admitted to a facility in the bordering state. Previously, the section used the term examiner rather than court examiner. The inclusion of the term court examiner in this part of statute creates a conflict with the definition of court examiner in the Civil Commitment Act, which governs court-ordered mental health treatment. the terms court examiner and examiner have different meanings, qualifications, functions, and duties under the Commitment Act. For example, the court examiner is appointed to serve the court and must be a physician or licensed psychologist with a doctoral degree in psychology, whereas an examiner is not appointed by the court and does not have the same professional or degree requirements. And in order to resolve the conflict with the Civil Commitment Act and retain the intent of the language that passed last session, this bill clarifies that individuals who meet the qualifications to serve as a court examiner or examiner may do so if they meet the applicable requirements under statute for each role. And so again, this is a cleanup bill from DHS. We've had a chance to talk to the relevant stakeholders, and they are all aligned on that this fix should be made.
Love to hear those kinds of bills, Senator Rasmussen. Any questions for the good senator from Fergus? None. Senator Rasmussen, your disposition of this bill, I think we want to put it on general orders. Is that correct?
That's correct, Mr. Chair.
So, Senator Rasmussen, I suppose you want to Senate file as amended be passed and placed on general orders. Is that the motion you want to make?
So moved, Mr. Chair.
All those members in agreement say aye.
Aye.
Opposed, same sign. Thank you. It is on its way. Senator Rasmussen, we have Senate File 1769, Fergus Falls Nursing Facility Fair Rental Value Property Payment Rate Authorization. Looks like Nathan Johnson has made the trip in to hang out with you. So it is. Senator Abeler just said it's Rasmussen Day in the chair. So, Senator Rasmussen.
Thank you, Mr. Chair. I appreciate the opportunity to have this bill heard. It's regarding Pioneer Care, which is a really top-notch long-term care provider based out of Fergus Falls. And I should know because I had 3 grandparents at different points who were residents at Pioneer Care, and so I've had a chance to spend a lot of time there. Back in 2010, Pioneer Care invested about $20 million in building a brand-new facility to best meet the needs of their residents and also the needs of our community. And since that time, the state has realized that their property rate system wasn't adequate. And so back in 2019, the legislature passed a new property rate system that uses fair rental value as the basis. And what that means for Pioneer Care is that between the old property rate system that they're on and the new fair rental value system, there's a difference in funding of about $1.1 million per year in the reimbursement that they get. Pioneer Care could get on the new rate, but that would require them to go through the moratorium exception process, spending $2 million or more on a capital investment. And so this bill would put Pioneer Care on the new rate, recognizing the recent investments that they made in a brand new facility, and avoid them needing to spend $2 million or more on a moratorium exception project when finances are stretched for not only them, but for the long-term care industry. Pioneer Care is fairly unique in their position of having recently built a brand new facility, but still being on the old rate system. And so I appreciate, Mr. Chair, you hearing this bill today and for the committee's consideration. And with that, I'll turn it over to Mr. Johnson.
Mr. Johnson, welcome to the Senate.
Yeah, thank you, Chair Hoffman, and thank you, Senator Rasmussen and members of the committee. I appreciate the opportunity to be here today, and you did a great job with that. So I think I'll just reiterate a couple of points that Senator Rasmussen made, and then maybe share a little bit more detail about kind of the numbers and the economic impact and what we're looking at with this. So again, just for the record, my name is Nathan Johnson. I'm a licensed nursing home administrator at Pioneer Care. We're a freestanding nonprofit in Fergus Falls. We operate a 105-bed nursing home. We also have assisted living, independent living, and we do some home and community-based services. As stated, this bill pertains solely to our nursing home, and the issue is our property rate. So again, up in Fergus Falls, we built a brand new nursing home in 2010, and I just want to emphasize that it was not a renovation. It was a replacement project. We spent about $18 to $20 million. It was significant for our residents and for our staff and for our community, big investment. At the time we built, the property rate system was not recognizing many of the costs for new construction. So then it was just a fast forward a few years later. In 2019, the state legislature recognized this problem and created a new property rate system using the fair rental value calculation, which in essence recognizes these costs that we're talking about, these costs of capital. So the problem for us is that the only way for us to access this system is to spend more money and do another major capital project under the state's moratorium exception process. So unfortunately for us, timing wasn't on our side. Our new nursing home remains on the old property rate system, and this results in a very large disparity between our actual property rate and what it should be under the fair rental value system, which I'll illustrate in a moment. But in essence, what I'm asking of this committee today is for you to pass Senate File 1769. Doing so does three things. It recognizes the investment that we've already made in our nursing home in Fergus Falls. It eliminates the expense of another moratorium project at this point in time when our building is so new. And ultimately, it puts the Pioneer Care nursing home on the new property rate system effective 1/1/24. So I made one slide to illustrate the economic impact of what I'm speaking about today, and you should have a copy in your packet. It looks something like this. As you can see, our current property rate is $21.23 a day. We estimate per resident per day. So we estimate that we have about 31,000 resident days. So if you multiply those two numbers together, you end up with an annual revenue of about $658,000 that we have allocated to deal with our costs of capital. And as you'll see with the new property rate fair rental value system calculation, that has us at about $58 a day or $1.8 million in revenue for it to deal with these same capital costs. We fall well short today. So we're diverting, I mean, in essence, we're not defunding depreciation and we're 9 years into this new building, and we're diverting money from operations to cover, the mortgage payment and the interest and such. So the difference between these two numbers represents the gap, and that's about $1.14 million. So this bill would close that gap for us. It would provide a net increase of about $1.14 million in new revenue for our nursing home, and our estimate of the state's share of those costs would be about $372,000. So I'll end with this, committee members. I'm asking you again to recognize the investment that we've already made in our community in Fergus Falls in this new nursing home, and allow us access to the new property rate system by passing Senate File 1769. Thank you.
Thank you, Mr. Johnson. Senator Rasmusson, I think one of the things that popped up when you look at, thank you for the fiscal impact. You got me on the diverting, diverting and shifting and all that good stuff. But in this case, I just popped the question why on the Senate File 1769 impacted the state of Minnesota, $372,000. That seems low. Why is that low? Can you explain that?
A few different reasons, and I'll have Mr. Johnson fill in any gaps. Part of it is that, with our reimbursement to long-term care, CMS pays a portion of that. And then additionally, by increasing the property rate, it also allows for the self-pay rate to also be increased along the lines of with the moratorium exception. So that's why the state dollars are really leveraged in this case. And so $372,000 from the state means, $1.14 million for this nursing home in this instance. Wow. So that's why it's so important. And that gap too, it's really, as Mr. Johnson stated, Pioneer Care is having to take money away from paying for nursing staff, away for attracting and retaining talent to kind of fund this gap.
Well, you get a 3-for-1 on this one then, basically is what you're saying. Any other questions for the good senator? Disposition of this, Senator Rasmusson, I know there was conversation about, did anybody know? I didn't see that. I thought somebody shouted, but we can send it to finance, we lay it over. I mean, what are you thinking on this one? Because
Mr. Chair, my preference would be to send it to finance and then perhaps, also consider it for inclusion in a potential omnibus bill, depending on what you'd like to do.
Yeah, I think we automatically do that. If you want to do that to, get your case, it's actually to understand that 3-for-1 piece is, that's kind of news. So, this one, members, any questions for Senator Rasmusson? Seeing none. No. Senate file, you want to just renew Senate file 1769, be passed and sent to finance? Is that what
So
you're saying?
moved, Mr. Chair.
So Senator Rasmusson moves that Senate file 1769 be passed and referred to finance. Clear? All members indicate by saying aye. Aye. Opposed, same sign. I knocked before I said the same sign as an ode to Senator Abeler. Speaking of Senator Abeler, Senator Etke, you got a question coming up? Senator Rasmusson, you might as well.
Yeah, thank you, Mr. Chair. As we were all sitting here kind of waiting to get going when we were watching our watches and watching the hands on the clock move forward here a little while ago, was there someone who kind of pushed us and made us a little later than normal?
Senator Etke, that's a great question. Senator Rasmusson, I know you don't, do you have the same type of question on that maybe perhaps somebody in education asked a lot of questions? Is that, you want to divert that question to somebody?
Mr. Chair, I did hear that, though I tried my best to get us back on schedule here today. So.
I appreciate that. Senator Abeler, any comments?
Take my comment to the table, Mr. Chair.
Senator Rasmusson, thank you, Nathan, for being here, and Senator Rasmusson, thank you. So thanks for letting me rearrange the order. I think we'll grab Senate File 2489, which is my bill, and Debbie Gray, right? Does that make sense to you? Yeah, we're good. So you want to figure that one out.
Just because we're running late, we're going to limit testifying times. So, Senator Hoffman, I appreciate you have a lot to say, but I certainly want to hear from the testifiers. So if they can go first, just to make sure we can fit it into our schedule, that would be perfect.
Mr. Chair, I saw how quickly the Vice Chair, Senator Fate, as I gave him the gavel, he just handed that over. I like that. That was, I guess I had that comment, didn't I, because of the fact that we're doing that. But
Mr. Chair, it gives them plausible deniability.
Mr. Chair and members, Senate File 2489 is legislation that will help improve the access to needed opioid treatment by freeing up counselors to provide more direct patient care while maintaining access to high-quality care for those seeking opioid treatment. The bill includes, there are two changes. The first change modifies when treatment plan reviews must take place, right? So under current law, treatment plans must be reviewed every week for the first 10 weeks of treatment, and then at least monthly unless the clinical need warrants a more frequent review. This proposal, Mr. Chair and members, would change the monthly review requirement to at least every 3 months unless the clinical need warrants a more frequent review. The second change modifies the maximum clients that a supervisor can supervise. Right now, current law states that a supervisor must not supervise more than 50 clients. This proposal requires that a counselor in an opioid treatment program must supervise clients at a level sufficient to ensure that patients have reasonable, so those lawyers like that word reasonable, and prompt access to the counselor and receive counseling services at the required frequency and intensity, but that the counselor must not supervise more than 75 clients. I authored this legislation. I'm interested in making the regulatory changes that will increase access to life-saving opioid treatments while maintaining counseling services at a frequency and intensity that's successful to the person that is being served. And so Debbie Gray, who's the Regional Clinical Director for the Minnesota for Behavioral Health Group, is here to explain how these changes will improve access to opioid treatment in Minnesota while also maintaining that high level of counseling services. So with that, Mr. Chair, Debbie Gray.
Ms. Gray, thank you. And even though the good senator did take a fair amount of time with his intro, you have all the time you need. Go right ahead.
Thank you, Senator. Mr. Chair and members of the committee, My name is Debbie Gray. I'm the Regional Clinical Director for Minnesota at Behavioral Health Group. I'm a licensed independent clinical social worker and a licensed alcohol and drug counselor. Behavioral Health Group has 4 OTP programs in the state of Minnesota in Brainerd, Brooklyn Park, Minneapolis, and in Woodbury. Thank you for this opportunity to speak in favor of Senate File 2489. This bill is about saving lives. It will have an immediate impact by allowing greater access to opioid treatment, and it will support counselors in focusing on the urgent needs of client care. Our communities are suffering as lives are being lost at an alarming rate because of the opioid epidemic. In fall 2022, Millennium Health, the predominant drug testing lab in Minnesota, reported a 400% increase in illicit fentanyl positivity in their analysis of urine samples from 2019 to 2022. Some regions in the state were even higher. St. Louis County, for example, reported a shocking 2,500% increase in fentanyl positivity for the same time period. At the same time, the addiction treatment field wrestles with this alarming increase in fentanyl use. It also faces a workforce crisis. The Minnesota Department of Employment and Economic Development projected a need for over 3,500 new licensed alcohol and drug counselors in Minnesota between 2016 and 2026, and that report was published before COVID. More recent information shared by the Minnesota Department of Human Services shows that the crisis is compounding as the need has continued to increase while current counselors are leaving the field. As Senator Hoffman stated, Senate File 2489 makes 2 changes that help address this crisis. The bill lessens the frequency of state-required paperwork, and it increases the cap on the number of patients a counselor can supervise. I have worked in other states that have very little oversight. Oversight regulations in this field are typically good as they provide needed guardrails to good clinical care. The proposed changes allow for that needed oversight, but are more in line with the federal regulations that SAMHSA and the Joint Commission outlined for opioid treatment programs. Deaths among Minnesotans from the opioid-involved overdoses have increased from 44% from 2020 to 2021. The need for people to get help with opiate use disorders is urgent, but the current regulations mean that many of them are forced to wait until there are openings once they seek help. Currently, when counselors' caseloads are full in an opioid treatment program, they are required to stop taking new patients. Over the past year, every OTP program in the state of Minnesota has had to close their admissions for new patients at least once. This situation makes it harder for people in crisis to access care. Senate File 2489 proposes to increase the caseload cap of counselors and OTPs from 50 to 75, allowing us more help to help more people with limited staff we currently have. The guidelines for OTP providers include many provisions that protect patients and ensure good clinical care. In my opinion, ratios or caps on caseloads often do not. The ratios do not recognize that each patient has unique clinical needs. Some have lower needs, some more intense. For some counselors, a caseload of 50 patients is appropriate, especially if their caseload consists of new or at-risk patients. However, as patients are stabilized, their needs decrease and the caseloads can be higher. Rather, relying on rigid ratios, this bill borrows new language from federal guidelines that states, counselors must supervise clients at a level sufficient to ensure that patients have reasonable and prompt access to the counselor and receive counseling services at the required frequency and intensity. It is also important to note that the proposed bill does not eliminate a ratio cap, but it moves it to 75, and it allows the local supervisors to determine what is clinically appropriate below that. The second element of this bill would decrease the workload burden on counselors by changing the frequency of treatment plan reviews for stable patients from monthly to every 3 months. Minnesota Department of Human Services published a 2018 workforce survey that showed a large number of people are leaving the profession due to dissatisfaction or burnout. The survey identified paperwork and documentation as the top reasons for burnout and stress. The demand for licensed alcohol and drug counselors is increasing, but we struggle to even keep the ones we have because of the amount of paperwork. This proposed change would free up clinical staff to spend more time with patients. Programs will continue to provide evidence-based quality care, but with this change, they can invest more resources directly with patients one-on-one. This change is also consistent with federal guidelines which refer to quarterly treatment reviews. I ask that you pass Senate File 2489. The changes in this bill will have immediate impact by increasing access to needed care and saving lives. Thank you for your time, and I'd be happy to answer any questions you may have.
Senator Hoffman, you actually found a good idea. Any questions from members? Oh, the department wants to testify, I think. Do they want to? You're never going to have me do this again, are you? Does the department want to say something? Somebody said they had a thought. No, she's shaking her hands, looking like she's coming. All right. Super.
You got a
Thumbs
thumbs
up on the way, Senator Hoffman. They're going to tell you what a good idea this is. I'm with you. You know, you can tell Senator Fate, don't ever do that again. So. Ms. Grom, welcome to the committee.
Thank you, Mr. Chair, and thank you, Senator Hoffman, for your work on this bill. Christy Grom with the Department of Human Services. We do have some concerns about this language. We have been thinking about, not just in this bill, but in other places where we do substance use disorder treatment, and how do we tie a person's treatment plan reviews to a person's need? And so that's something we've been working on for the course of the past year, and might have some recommended technical assistance to help get this bill into a different shape, maybe a more agreeable one. On the ratios, we do have some concerns in terms of health and safety, both in our BHD, Behavioral Health Division, and Licensing Division. We do see that as too high of a caseload, and would like to continue to work with stakeholders maybe over the course of the interim on some of the workforce challenges that they're experiencing and how we can come together to create a solution that's workable for all of us. We certainly understand that access to these services, they are life-saving services, and we really appreciate the importance of making sure that people have access to these services. So we're with you in many respects, but there's still some work from our perspective to be done on this bill.
Yeah, Ms. Grom, while you're here, and you know you are a favorite of this committee, so so don't mind my questions, too bad. And so I don't think there's time to wait for the interim, personally. So there's a little bit of time. It seems there's only two numbers you're talking about, 1 month, 3 months, 50, 75. And so is there a reason that some people, it seems like there's a class of people who just need to be evaluated every 3 months, and some need more often. So do you disagree with that statement?
Mr. Chair, I think yes, people are at different places in their recovery journeys. People who are experiencing opioid use disorders are, in a pretty vulnerable situation. You've had pictures of a gentleman in this committee last year and talked about him this year. We want to make sure that the care provided at these treatment programs is, quality care, that people are getting access to the services that they need, whether that's the medication itself or also individual counseling, group counseling, referrals for comprehensive assessments. So we do really want to make sure that people have access in an even 1 to 50. I mean, if that were one of my loved ones, that seems like a pretty high ratio as it is. So I think we have, on that aspect of the bill, we need to continue to work with stakeholders to address some of the transparency and kind of quality concerns at these settings so that we can come up with a solution that's workable. I think under the governor's proposal related to opioid treatment programs, one of the things that we're hoping to do is really to create a scenario where we can collect data to understand what services people are getting. Right now, we don't have that the way the billing structure is set up, so I think that might be part of the solution that we can work towards.
Senator Hoffman.
Thank you, Senator Abeler, Mr. Chair and members. Interesting. I usually don't like to voice concerns, but when DHS licensing has never told me what these concerns are. This is the first time I heard from the department, and I know they didn't testify in the House, so I'm glad that you brought them up here, because now I need to take a step back.
Senator Hoffman, Ms. Grom is the messenger.
I know, I get that, Mr. Chair. I just am a little blown away that they would not approach me prior to coming here, because these are solvable solutions. Number one, you know, LADCs, there's less available. People are needing those. And you're looking at the required paperwork. When you really look at the language of this bill, Mr. Chair and members, it really is about once somebody gets to that stabilized, or they're more structurally stabilized than they are, then you can start looking at that the guidance that are there under federal regulations that SAMHSA laid out for that, right? And you, Mr. Chair, a couple years ago had a bill that was a pilot project that Anoka County is utilizing, and they're putting people's ability to use apps to really, you know, because we believe that connection is the opposite of addiction, right? And these apps are going there. So I think it's a good segue and a premise to having a deeper conversation just about addiction as it is. But we know in this realm, I think what we want to do is I want to lay this bill over, and if the department wants to set up an appointment to come visit me to have conversations about how that would look, I'd be more than happy to offer my office as an opportunity to have that conversation. So with that, Senator Abeler, I would like to have this bill laid over for possible inclusion.
Senator Hoffman, people have questions. Thank you for trying to save the time and make up the schedule that some other people seemingly have had some minor impact on. Senator Mann.
Oh, I didn't know people had questions, Senator Abeler. You're good.
Thank you, Mr. Chair. I had some of the same concerns, although some of the language does help. I work in a substance use disorder facility, and a lot of things can change in 1 month's time, a lot that impact your recovery journey. And so 3 months to me is a lifetime in acute recovery. However, when clinical need warrants, and more frequently that does help that concern that I have. And I would imagine that most people would need it, honestly, in that time period, from what I see. And then my other question is that, you know, counselors are burning out. We have had such turnover in counselors because the patient acuity is getting heavier, and more patients are more complex, and it's becoming it's a hard job. You take that home in your gut with you every day and in your heart, and it's a hard job. And so to increase that from 50 to 75, I just want to make sure that we've had conversations with the counselors, with the boots on the ground, and that they're all in agreement with this as well, because if not, that could be problematic.
Absolutely, Mr. Chair.
Yeah.
I'd like Debbie Gray, actually, to that point, you know, when you look at the LADC side of it, the conversation, but to your point, you're right. When you start to get at the clinical decision, hence, you know, on the who's going to make that decision, and Ms. Gray, if you could address that,
Ms.
I
Gray.
would appreciate that.
Senator Mann and the committee, one thing about opioid treatment programs, there's a lot of oversight, more so than other modalities of substance use treatment. You know, the DEA, there's oversight, pharmacy oversight. And so, you know, I think the treatment plan reviews are not the only thing that regulate the frequency and the amount of services. It's just it's another layer of paperwork. So in 245G standards, you're still required to meet with patients when they first come in, the first, you know, 14 weeks weekly, and after that monthly. So the treatment service plan review is just a layer of paperwork. So the frequency and the amount of contact and services provided will still stay the same, will still be with regulations, but they, you know, basically it's that extra piece of paperwork. The other thing I want to put to this is, you know, the ratios are not a good measurement of caseload sizes. I've been in the field for over 20 years. Caseload sizes are important because, you know, that's the fastest way to burn out someone. But in this context, it's not a good measurement. And so, you know, the opioid treatment field is changing. And, you know, one of the biggest things as counselors and as managers of counselors is really identifying risk and getting people in, because it really is life-saving. And so I think that's really important, but counselors have gotten better at assessing risk and then being able to, be creative and come up with ways for people that have stabilized to still have contact with them, but maybe not as intense. I don't know, did that answer the question, Senator Mann? Okay.
Okay. Let the record show thumb up. Not thumbs, just one thumb up. So it's pretty good. So she's helped. Other questions from members? Senator Hoffman and Ms. Gray and, well, Ms. Graham. So I don't know a lot about the day-to-day work of this. Senator Hoffman, I know you're familiar with these apps that are coming out that are highly effective, where a person can monitor a whole bunch of people on their apps. They check in and so on. Ms. Gray, is that a part of what you do now, or is that coming?
I've been to conferences and been involved in some of those apps, but the biggest barrier to not using those apps is they're not reimbursed by payers.
Oh.
So, I've worked in other programs other than the current position I have that we have used those, and they're only based on grants, so they're not sustainable.
Right.
But I think that's what the future is. So
Well,
yes.
that's good. Yeah, so let's go back just to functionality. And it seems like if you're having I don't know how many, I can't imagine having that many people, but I can't imagine 50 myself. But you live in this world, and I'm not going to question your expertise. But it seems as the world is evolving into more of this, they're checking in by an app, and here they check, okay, well, at least they wrote something, and so you can check the box on those. And then if they don't start reporting, now you got somebody you have to go after. That would give you more capacity as well in the vein of this. And so, Ms. Graham, maybe we can figure out a way to get some of these apps like squared away. I realize it's keep reading this stuff. The DHS and the Walls Planning Administration support investments to increase access. So maybe that's something they'd like to support to increase access and capacity. So I'm just here to help, as you know. So. Thank you, Ms. Graham. Senator Hoffman, do you want to have last word?
Senator Abeler, yeah, I appreciate the question, and I saw firsthand a gentleman who was absolutely, because he was utilizing the app and he was doing his daily check-ins with the app and the clinical doctor who was part of this team. It's absolutely amazing how you talk about wraparound service. That's a 70s term, but in this case, it truly is real. And we saw this gentleman who was not getting sleep, sweating, just one of the clinical docs told the person that was the peer and whoever else, there was a whole team in there, might want to check on him. It's not the weekly or the 10 weekly or the bi, but this was all of a sudden for 4 days in a row. And what they found out that he didn't have his insurance coverage to carry the medicine that he needed to keep him from having his addiction. So he was going to this heavy withdrawal. I don't know the term that is used. There's people here that you probably know that term. But I saw firsthand how that app saved that gentleman's life. I mean, it truly was. The people were able to assess that, look at it right away, and they acted. They got that person the medication that he needed in order to keep his heavy withdrawals from happening. And he's been sober, and he's alive today because of that app. And I absolutely believe that there should be more access to that piece of it. So seeing things like this, and knowing the world, we all have personal friends that have died from opioid overdose, and there's somebody near and dear to our heart, Senator Abeler. And so with that, I would continue this conversation. This is one little thing in it, Senator Abeler.
So you're looking to weave this into the comprehensive, collaborative, and coordinated approach to serve these individuals, using the amazing power of DHS with their ability to buy stuff, and with Ms. Gray and with you all. So anyway, anything else, Senator Hoffman? Are you done?
Thank you, Senator Abeler.
The bill's laid over.
Thank you, members. Thank you. Yep. Duly noted. Senator Fate, I make a motion that if I give you the gavel, you shall never give it to the good No, I'm kidding. I would just like that. Thank you, members. This is really, these are decisions are life-saving conversations. And so Senate file, speaking of that, Senate file 2490, Senator Abeler, eligibility modification for recovery community organizations, also known as RCOs. And I see you have a Randy Anderson, speaking of LADCs, you're one of those. And Senator Abeler, I think you have an amendment to produce, so?
And I have a little intro. So just to, Mr. Chair, the committee chair gets to set committee rules, so you're accountable for what happens to you. So anyway, so the matter of recovery, RCOs, recovery community organizations, has been one that we have spent a good deal of time on in the past couple of years. And it didn't, they were nice to have around. There was a cluster of them, maybe 16 or 18 or growing number. And then and they would serve individuals, and Mr. Anderson can go into some more detail. My comments are actually quite brief, Mr. Chair, compared to the Education Committee beforehand when they weren't quite as. But they do have the ability to engage people and save lives and improve outcomes in a great way. And so until we started giving them money, it didn't matter because they were just scaring up their own monies from wherever.
Makes sense.
And then a budget happened, and then there was a gatekeeper, and that wasn't quite as successful. And we had spent actually several hours of committee time engaging in this. And Mr. Anderson and others have taken it upon themselves. The department also has a somewhat similar, at least the same idea proposal, which I think as we go forward we can meld this with. But Mr. Anderson has been actually talking to a lot of the players, and while the department's not ready to sign off on this, they think we're in the right direction. And if you want to talk to Ms. Graham about that later, you can. But so I present to you Senate File 2490, which is a product of organic work in the state of Minnesota at the hands of this gentleman and his peers. And there is an amendment which will make the bill make more sense. And just because I think amendments should be explained a little bit, I would like to move the A1 amendment, and then Mr. Anderson could describe it, at least in broad detail, and then we'll adopt it, and then the bill will be ready to be discussed.
Mr. Anderson. Thank you, Mr. Chair and Senator Abeler.
So the A1.
The A1 amendment. So it really just is more of a language cleanup bill than anything to start with. And I think the bill isn't done yet either. I know there'll be probably some more changes as we move it along here. But when I met with stakeholders in the off session, last year we brought this bill forward for the first time, and there was some concern from the RCOs mainly, and from an organization newly formed that will soon have some teeth, hopefully, called MARCO, which is the Minnesota Alliance of Recovery Community Organizations. They had some concerns about the way it was laid out. And so I met with them offline before session started and asked them what would it take to get you on board and support this legislation. And this A1 amendment is basically that, changing a little language, not necessarily, they were very concerned it might try to define RCOs, which that wasn't the intent of the bill. This bill is just about vendor eligibility, really. So anyways, it's more of just cleaning up the language, more talking about the board structure of the Minnesota Board of Recovery Services, and in my testimony, I'll provide why I think and why the recovery community thinks that's important. So that's the A1 amendment.
So, Mr. Chair, the vote really is to have the bill cleaned up or not cleaned up. If you want it cleaned up, please vote yes. Thank you.
Any questions for Senator Abeler on the A1? Not. Senator Abeler renews his motion for the A1 amendment. All those in favor say aye. Aye. Opposed, same sign. Senator Abeler, the bill is now in the form and
Okay.
whatever you want. So, Mr. Anderson.
Good afternoon, Mr. Chair and members. My name is Randy Anderson. I'm a person living in long-term recovery from substance use. What that means to me is I haven't used alcohol or drugs or any mood-altering substance since January 9th, 2005. Thank you. 2 decades almost, well. And because of my recovery, I'm able to have healthy relationships, own a home, run a successful recovery-focused small business, vote, and even pay taxes. I'm also a Minnesota state licensed alcohol and drug counselor, a peer recovery specialist supervisor, and a formerly incarcerated person who was sentenced to 87 months in prison as a first-time nonviolent drug user with little to no criminal history. As overdoses and overdose deaths continue to skyrocket, it is clear that what we are doing and have always done isn't working very well. We need to think outside the box and invest in new and innovative services to help Minnesotans struggling with substance use find a path to recovery. I've traveled across this country, and I can tell you that Minnesota has one of the most, if not the most, robust treatment systems anywhere. We do an above-average job of getting someone into a treatment program to initiate their recovery journey. What we don't do a very good job of, and frankly neither does most of the country, is working with the person before or after treatment. And not everyone that struggles with substance use will need formalized treatment. There is an enormous amount of growing evidence that shows the effectiveness of peer recovery support services. A certified peer recovery specialist is an individual who can meet people struggling with substance use or already in recovery where they are and walk with them to find the path that works best for each person. Minnesota has many amazing organizations that have trained thousands of individuals to become certified peer recovery specialists. Unfortunately, many of those never enter the workforce for a variety of reasons. Just imagine if we had opportunities for those trained professionals to find meaningful employment in a community where they grew up, where they went to school, a community or city that they call home and care deeply about. Peer recovery specialists are now working in places across the spectrum of care and in more diverse locations than ever, such as hospitals, prisons and jails, recovery high schools, collegiate recovery programs, and more. As this service grows and expands, we need to ensure that there is oversight, some regulation, accountability, inspection, and enforcement to maintain a high quality of service and protect the workers and those that we serve. The Minnesota Board of Recovery Services could do this and more. I have met with and received input from dozens of individuals from the recovery community, and we all agree that any such regulatory body and governing should be done by the recovery community. Still, and for far too long, recovery voices have been an afterthought and don't always get a seat at the table. My father once told me, either you have a seat at the table or you're probably on the menu. I, for one, refuse to be on anyone's menu. We, the recovery community, believe it's time that we create our own table, and we invite you to join along. Thank you for the opportunity to share my thoughts with all of you today.
Thank you, Mr. Anderson. Members, comments, questions? Senator Abeler?
Mr. Chair, I didn't ask her if she wants to come down, but I think it'd be productive if Ms. Grom came down just to kind of keep us in the loop on this. This is a high-value project. Ordinarily, this bill would be moved to the State Government Committee. I'm not sure if it's ready for that. The committee can decide that, I guess. But you want to come down?
Before they come down, Senator Abeler, I want to, you had, last year, I remember this was part of the discussions that you were having was this credentialing, non-credentialing, and I'm seeing, so I'm glad that you're having this discussion again this year on that, is because there is some concerns, at least in my opinion, and I have no conflict of interest anywhere near any of this, just to let you know that. When you have an association that's making credentialing decisions on behalf of a state, there seems to be a little, I've always had concerns with that, and so, and I want to make sure when we're talking this conversation that this is brought up. So,
Sorry, go ahead. I'm sorry, Mr. Chair, Senator Abeler. And this bill really is, there's two buckets here. One is, what does an RCO look like in Minnesota? And this bill isn't that.
Okay.
What we're trying to do with this bill is just to create, like, who can be a eligible vendor for the service, because it is a Medicaid reimbursable service. So this bill strictly is like creating a pathway for an entity that wants to offer this service and seek reimbursement. That's all this bill, its intent is. Again, maybe we need a little bit of technical fixes with it. I'm not an attorney. I did my best when we talked last year with Senator Abeler to put this together. And again, as I mentioned over the off session, we talked to those that we had some opposition. So we talked to many of those stakeholders, and they agreed that if we had this type of language that they could get behind and support it. So anyways, it is not about creating, like, what does an RCO look like? This is just strictly vendor eligibility.
got it. Thank you, Mr. Anderson, for clarifying that. That allows me to stay within one bucket of conversation. So, Senator Abeler?
So, Mr. Chair, I wish we were a month ago on this so we could, try to get it through the process. I don't know how it makes first deadline, even if we voted out of here today. But I think this is a very safe place for it to reside, in my opinion. So we can discuss that at the end. And Ms. Grom shared with me some of her thoughts, and I have a high degree of value of her thoughts. And so I just drug her down here. And she can say whatever she wants about the bill, but even about the general effort. Because at the end of the day, Mr. Anderson, Ms. Grom, the department, Senator Hoffman, you and the committee actually want these organizations to do their work and save the lives they're supposed to be saving and help people to be successful like this gentleman.
So Senator Abeler, if I would note, there probably is going to be a fiscal note because there's a board, there's a notation in the amendment, I think, I'm going to ask the question that Senator Utke would always ask. Is there a fiscal note attached to this? I don't think, but I think there should probably be one. So I think that your piece about, making deadlines, we should have this conversation a month ago or so.
Yeah. Well, Mr. Chair, it would be a fiscal note, not from state monies. I would think it'd be, the fees would pay for the board, I believe. So, but anyway, with that, maybe I'll just let Ms. Grom talk about her general thoughts, because this is a really important topic. And so anyway.
Ms. Grom.
Thank you.
Mr. Chair, members, Christy Grom with the Department of Human Services. We really support the efforts that Mr. Anderson and others in the RCO community and the peer recovery community more broad have been making. We have been working over the interim with Mr. Anderson and many others. The governor, in your packets, you can see, has a position on how we can improve and expand access to these really critical services that are rounding out the continuum so that people can maintain that long-term recovery, and when they maybe need just a little bit of extra support but not treatment, that they can access those important non-clinical services. So we're right there with most folks, I think, in terms of the policy goals. In terms of the bill, I think we have a little bit of a different approach in the governor's budget. We're definitely open to ongoing conversations and talking about what a board might look like, what kind of regulatory function it might play. I think the governor's position really does also try to make that distinction of what is an RCO and what fidelity standards do we need to have in place to maintain that important model, and then what does it mean, what are the requirements to bill MA peer recovery services or other peer services. And so in the governor's proposal, what we're looking to do is just kind of separate those two things for the most part. RCOs could be an eligible MA vendor, but when it comes to making sure that that peer recovery services are done so in accordance with the laws and serving people well, we do take fraud very seriously at the department. So if there were to be some kind of issue with peer recovery services being billed inappropriately, we would certainly be investigating that. We have folks at the department that do that on a routine basis for all of our MA services. And of course, there are other opportunities for the Attorney General to get involved when things aren't being delivered, when services aren't being delivered appropriately under Medicaid laws. So a little bit of a difference of opinion in terms of the strategy here, but really want to thank Senator Abeler and Mr. Anderson for all of their work on this.
It's a good discussion, and for the members that are newer to this committee, it wasn't going well. And so I commend the community.
Yes.
For working on this approach. And I'm happy that there's two ideas here in front of us. And there's maybe not time for the official process, but there's plenty of time to figure out what direction the committee wants to go in under your guidance, Mr. Chair, and of the members. So I'm kind of liking the fact that we're here today with two solid ideas. And as anything, we blend good ideas, Mr. Chair. Thank you.
I just like to make deadline.
Mr. Anderson?
Yeah. I mean, I've worked hard on this bill, and and we do have a House version that's that will meet second deadline, and I would encourage the members to I'd like to meet the deadline and get this moving forward. And if we have to work on it and change it in the next stop, so be it. That is great. I think every bill I've ever worked on has been like that. I don't think I've ever helped a bill that's been done, one and done, and fixed the right way. So that's my desire today, but I'm just a citizen advocate, a recovery advocate that thinks this is something that needs to be done, and I would love to see the recovery community really get a seat at the table, make our own table, right? It's about we get to decide what is best for our community and our populations and the people we serve, right? That's to me what the heart of this bill is about. So
I appreciate that, and so Senator Abeler?
Well, Mr. Chair, so just to keep it moving, at least so this committee is not the barrier, would you mind if it was sent off and then it would come back here?
No, Senator Abeler, I think that with a couple of things, I think it looks like state and local government wants to see this, right? Is that correct? Yeah.
It's got the board.
It's got the rulemaking, it's got the board in there, and so I think between then it is I would
All right.
I would strongly recommend that you and Mr. Anderson and the department figure out a pathway to this, because I would appreciate the collaboration on that. And I don't want I don't like any surprises. So with that, Senator Abeler, do you want to renew your motion?
Yes, Mr. Chair. I would move that Senate File 2490 as amended be recommended to pass and be referred to the Committee on State and Local Government.
Any, all those that agree, say aye.
Aye.
Opposed, same sign. It's on its way. Thank you, Senator Abeler. Senator Fate. Senator Fate, you can tell Senator Abeler that on your way by him. Josh Berg, Senate File 2725. Senator Fate is requiring some exceptions to size limitation for customized living and 24-hour customized living services for certain settings. Looks like we got a bill. And you don't have an amendment. You have no amendments to add. So, Senator Fate, table's yours.
Thank you, Mr. Chair. I'll try to be brief and I'll pass it off to the testifier. Just a few points to the bill. Josh worked with DHS and the revisor's office on language and helped get it to shape it to work out operationally. This bill would allow DHS to apply the exception already in place to the 25% cap on the number of individuals on CADI BI who receive customized living services in these 3 residential settings, which are 2 in Minneapolis and 1 in Grand Rapids for accessible space. These settings would otherwise qualify for the exception, except for the fact that, 1, they technically have not provided customized living services continuously since May 1st, 2001, even though they have provided the equivalent service since as early as 1980, and were approved by DHS to not transition to customized living in the 1990s, early 2000s. And 2, because they are HUD settings that require a permanent physical disability to qualify to live in them, they are automatically excluded from being considered for the exception. These settings have open units ready to serve low-income individuals with disabilities who are currently stuck in hospitals, SNFs, etc. But because of the cap, no one can receive customized living services who are on CADI and BI. And with that, Mr. Chair, I will pass it off to our testifier, Mr. Berg.
Mr. Berg.
Thank you, Mr. Chair. And thank you, Senator Fate, for carrying this bill. For the record, my name is Josh Berg. I am with Accessible Space. Again, thank you to Senator Fate for carrying this bill and representing the constituents, both current and future, at 28th Street House located in Minneapolis in his district. Also, thank you to the department, Natasha Mers, no longer the interim assistant commissioner, Christy Grom, and the team for providing the excellent TA, and Alex over at the revisor's office for the super fast turnaround, in getting this language all buttoned up. And a special thanks to the committee dictator, Kevin Parker, for finding time for this important bill to be heard. Appreciate it more than you know. I've spoken on this bill or issue in the past in this committee, so won't get into great detail unless folks have questions. But the summary, as Senator Fateh alluded to, essentially gives DHS the cover and permission to apply the exception of the 25% cap on the number of individuals utilizing CADI and BI under the age of 55 who receive customized living services in these smaller home-like settings. For several reasons, as Senator Fateh commented on, these ASI communities do not qualify for the exception as it is currently written. Even though they technically have not provided customized living services continuously since May 1st, 2001, they have provided equivalent services since 1980. And I have letters from DHS dating back to 1995 with Tom Moss and 2006 with Lauren Coleman, allowing ASI to hold off on making the transition from shared pooled PCA to customized living. Just a little side note, ASI was the first contracted organization in the state of Minnesota to provide pooled PCA. And so we provided the exact same services through the early 2000s, which is why we didn't transition to customized living at that point in time. And then also, as alluded to or mentioned, these are HUD settings that require a permanent physical disability for folks to live there. And that's one of the exclusionary criteria in the exceptions process that won't allow us to even apply for the exception. So this bill simply allows individuals to move into these settings, receive customized living services from the staff who are already on site 24/7, 365. We have several open units in these settings as we speak, and we have folks that are currently living in HCMC and other settings that we hear about with the whole hospital decompression issue going on. We have places for them, we just can't move them in because we can't provide the customized living services to them. This bill prevents the closure or ending of services in these settings. Currently in our one setting in actually Senator Champion's district, our Camden home, we have 3 open units out of the 6 units in the home that we have been unable to fill and have lost, I think, about $250,000 over the last 3 months in these 3 settings combined. So really trying to prevent the closure and displacing many of the residents who have been living in these settings for quite some time. One of our residents is a board member of ASI and has been living in 28th Street, which is in Senator Fateh's district, for 42.8 years since it opened in September of 1980. So we're really looking to prevent any disruption to those services. So thank you for considering this bill. Open to any and all questions, and look forward to the hearing in the House next week.
Thank you. Thank you for bringing this. I just sat here and I was going, this is the federal HUD to state services. I just said, wow. In your view of, are there other places like this that could be benefiting from this? Do you know off the top of your head, Mr. Berg?
Mr. Chair, and thanks. And, we actually have like 9 minutes, so I'm not even.
All right. So line up. You want to get, let's get the lineup thing. I love the response, the inside baseball on the committee administrator. That was pretty funny. That's actually goes back a few months, but you do have time. We're okay. We're not since the Department of Education, since Education Committee decided to, hold us over for 5 minutes. I think I might just lecture for 40 minutes and do that. But no, seriously, I mean, this is a big deal. And I'm sitting there going, wow, our system is kind of, messed up on that. Can you help with that?
Yeah, Mr. Chair and members. So there are several organizations and communities. You've heard a lot from RPAM over the past couple months, and they've been doing a great job bringing awareness to a lot of these smaller residential settings that are stuck in the space that these settings are in as well. So because there is these are HUD facilities, HUD communities, everybody is low income because they meet the financial requirements to live in these settings. Plus, they were all funded under the 202 and 811 programs. So with many of these, they require a permanent physical disability to live there. So all of these settings are kind of stuck here in this space, and I've been working with other legislators, Representative Knorr, in discussions about where do these smaller residential settings that primarily serve folks on Caddy and BI, what are we going to do? Because I would love to transition these to the ICS model. I would have done it months ago when we transitioned the 8 other settings that we have, but because they are shared residences, they don't have their own individual bathrooms or kitchens or independent living units, we can't transition them to ICS. And because they're too big for the CRS settings, we can't move in that path either. So over the next, couple years, months, whatever it'll be, we'll work with the department. I know I have the Improve group coming out next week to do a site visit at 28th Street, and then some virtual visits to kind of give them a feel and a taste of what goes on in these kinds of settings, to really be a part of the conversations of where do we go and how do we continue to support folks that have been living in these homes, their homes, for decades, and providing the support and services that they choose and want and need, and do it in a really efficient way. So, yeah.
Senator Fate, I remember when you first came in, 2020, this is one of those things you, as a freshman, were like, all right, so thanks for keeping the momentum going on discovering how we can do better, and I appreciate that. Any questions for Mr. Berg or Senator Fate? Seeing none, I think the Senator Fate final word, and then if you want to make a motion to lay this over, we're good to go. So
Yeah, I just want to thank Mr. Berg for bringing this to us, and I appreciate the committee for hearing this and hope to earn the support. So I would like to move to have this laid over.
awesome. So we're going to lay over Senate File 2725 for possible inclusion. Thank you for your work again on that. So seeing no other, unless you got another bill you want to bring up, Senator Rasmusson, is that, not today? Thank you, members, for this conversation. I appreciate each and every one of you, and with that, we are adjourned.